Hey mamas, and welcome to the Entering Motherhood podcast. I'm your host, Sarah Marie Bilger, a wife, mom of two, VBAC mama, and doula. Join us every episode to learn from professionals, special guests, and moms just like you, ensuring that you know what you need to know and discover things that you didn't know before. I believe in you. Let's doula this, and let's navigate the transition of entering motherhood together. Hello, and welcome back to another episode of the Entering Motherhood podcast. I'm your host, Sarah Marie Bilger, and I'm super excited to be here today and chat with y'all. We are talking about gestational diabetes and what it means, what you need to know, and my personal experience with that. So I just recently had my testing done. It is blood work that you have done typically around 28 weeks. And so I was right around that mark, and this is baby number 3 for us. So I have never tested positive for gestational diabetes before, but I was just nervous because you never know, and things might change, things might be different. I haven't been feeling any differently necessarily this time around, but it is just something that you can test for, and I just recently had that. So this was the first time, though, however, that I decided to do something different for my first 2 pregnancies. I did the standard glucose drink. It's that, orange or lime syrupy drink that most of us know. Most of us are probably going to take, that our provider has. Most of us are probably more familiar with. It is very thick, and, some people enjoy it. Some people don't mind it. I definitely recommend, if you are choosing to have that one, to make sure that it is very cold because it's easier to consume that way. But this time around specifically, I chose to do the fresh test instead. So if you haven't heard of that, I encourage you to check it out. Some providers actually have it available as an option. My provider was one of those. I am with a midwife, and she had it available for me to take and use for my gestational diabetes screening. And this is just a lot cleaner, more natural version of the standard glucose drink that they give you. And it has the same amount of sugar levels. It's just a different option. And I honestly thought this was a lot better, very easy to drink. I almost just felt like it was, one of those powdered drinks that I put in my water and add to my water when I am looking for some flavored water. So I really enjoyed it this time, and I didn't feel like it was hard to drink within the 5-minute time period. It's just another option that's out there for you if you are looking for a more natural version. And so with that, I just want to talk a little bit more about what gestational diabetes actually is and where this screening came from, what the numbers can mean, and how it can ultimately affect and impact your pregnancy and birthing experience. So really, to begin, what is gestational diabetes? Basically, it's when your body is having a harder time managing your blood sugar levels during pregnancy. Normally, your insulin helps your cells absorb glucose in the blood, but in pregnancy, with hormones from the placenta and just other factors in general, it sometimes can interfere with that process, which leads to higher blood sugar levels. And in most cases, gestational diabetes is just temporary, and it just resolves itself after birth. It's not something that you're going to have lingering diabetic symptoms or lead to any long-time diabetes. It's just important to monitor because elevated blood sugars can impact both the mom and the baby if it's left unmanaged. So we really need to consider testing for this just so we can be aware of it and that we can help manage it in those later weeks of pregnancy. just a little history about the glucose tolerance test. It became more of a common practice in the 1960s and 70s when doctors noticed the link between high maternal blood sugars and larger babies and more birth complications. So they really began testing for this, and it became a standard to test with the 50-gram glucose drink when mothers are around 24 to 28 weeks pregnant, gestationally. This is just typically followed by blood work to check your body's response. And so that's what they're doing. You drink or consume the glucose drink, or like I said, I did the fresh test this time. You're getting those 50 grams of glucose in your system, and then they are drawing your blood, taking a sample, and they're testing how much sugar is in that blood. And if the numbers come back really high, then it's usually recommended to take a longer test. So normally you're doing maybe a fasting option, then along with a 1 hour test, which is 1 hour after consuming the glucose drink. And then there's also a 3 hour test, which is just a little bit different in how much glucose is consumed and then the time frame afterwards. And so with that blood drawn and the labs done, there are certain values that they would like to see to really help determine if you may be on that borderline of having gestational diabetes or not. So just keep in mind, too, that every lab can have slightly different ranges, but in general, we're looking at if you are doing just a fasting, trying to see glucose levels in your blood, it's typically wanting to be under 95 milligrams per deciliter. And this unit specifically is saying how much sugar or glucose is in every deciliter of your blood. So that's what we're looking at, like the milligrams of sugar in every deciliter of your blood. And that's what these values are showing. So like I said, fasting, we want to see it under 95. And then if you're doing the 1 hour glucose test with the 50 grams of glucose, we want to see it around 130 to 140 milligrams per deciliter. And then higher values are going to be up above 140 to around 200. And then if it's above 200 in that 1 hour test, this is usually considered to be for sure gestational diabetes if you are hitting over that 200 mark. And so this is probably when they will want to either see you do the 3 hour glucose tolerance test or just immediately kind of categorize you as having gestational diabetes if you are hitting over 200. And then for the 3 hour glucose tolerance test, we want to more so see 140 milligrams or under after that 3 hour mark. Typically, failing 2 or more of these values is going to confirm that you do indeed have gestational diabetes. And again, these are really just general guidelines. You should always just be following up with your care provider because those thresholds can vary. And if you are kind of right on that borderline, they might be able to talk to you a little bit more about just managing or doing some sort of at-home test to help really clarify these values and get a better idea for what's going on. And so what happens typically when you're diagnosed is that for most women, gestational diabetes honestly can be really well managed through nutrition and movement and monitoring. Sometimes you might need medication, specifically insulin might be needed, but that's not always the case. So it's really good to just start looking at your nutrition and doing some, like I said, at-home monitoring before we're starting to introduce that insulin or the need for insulin to be introduced in pregnancy. And then some big concerns that your care provider is usually looking out for is baby's measurement. And so they might want to just check and see how baby is measuring, if they are larger than average, which can then occasionally increase the chances of interventions during labor. And I can honestly do a whole other episode about that and talking about large babies. I feel like I have talked about it occasionally on a few occurrences when it comes to cesarean rates and large babies and things like that. But if you have any other questions about your baby measuring too big or what that might look like, or the increased chance of interventions and such because of large babies linked to gestational diabetes, then let me know and I will certainly create another episode that's specifically for that. But another concern that providers are usually finding is just your blood sugar fluctuations during labor. And so this can just really be a concern because we don't want to have drastic blood sugar levels fluctuating, and we want to try to just keep that as level as possible. And then it can cause a slightly higher risk of cesarean delivery in some cases. So again, I am very much VBAC supportive and leaning away towards cesareans, but I understand there are different circumstances where it is necessary, and ultimately it's your choice moving forward in how you want to birth your baby. So really what I want to point out and talk about specifically here is dietary awareness, regular movement, and good blood sugar monitoring. And this is how many women can go on to have very healthy, safe vaginal births despite testing for gestational diabetes and being confirmed with having gestational diabetes. So a few quick tips here that I love to share with clients is to make sure that we are pairing our proteins and fats with a carb to really help stabilize our blood sugar. Really upping our protein levels in pregnancy is always great, but it can be extra beneficial when we are showing signs of gestational diabetes or having those high results in the glucose test. And then another thing is choosing complex carbs. So really looking more at sweet potatoes, quinoa, lentils, things like that that don't have any overly processed sugars in them. And then we can also just walk or do some gentle movements after our meals to help your body regulate your blood sugar. So maybe after every meal, you go on a 10-minute walk or you walk around your house. Or I've seen a lot of people now with those in-home walking treadmills. It's not like a full-blown treadmill. It's just a walking pad that you can just use to stroll around a little bit in your house for 5-10 minutes after every meal. And then another huge one is staying hydrated. So making sure that we are consuming lots and lots of water or fluids in general. If you need to add different electrolyte packets or flavored packets or whatever it might be, that is okay. But making sure that we are staying hydrated, and especially on the day of the test when your blood is going to be drawn, I don't believe that you can trick the system or, manipulate your test so that you don't have gestational diabetes. But I do think there are some things that we can help to level out the results and really show a clear interpretation of our results. And that is by staying super, super hydrated, making sure that we're drinking lots and lots of water, and then also adding some protein in the morning before you take your test and you have to fast for that 1 or 3 hours for the blood work. And then also just remember, this is all about supporting your body and supporting your baby. It's not about guilt or shame. It's nothing to be upset about or feel bad. I know sometimes people are like, oh my goodness, I can't believe I have this, or how did I get this? Like they try to like put this blame game or guilt into it and just say like, I can't believe I had this, things like that. And honestly, like I said, it's just your body responding in a different way. There are a lot of hormones and factors at play. And so it's really just, taking the results for what it is and saying like, how can I support my body and my baby moving forward? And how can we move on and navigate and transition through this so that I have an amazing end to my pregnancy and I remain healthy and proactive and just aware of what's to come. So that's really just a brief overview of gestational diabetes and what the results are showing, how we can kind of help as far as nutrition and movement go, and what this might mean for your pregnancy moving forward. As always, if you have any questions, I am here to answer them and reach out. If you are somebody who has personal experience with gestational diabetes and you want to share a little bit of your story with me, I would love to hear that. There are also some really amazing resources for gestational diabetes specifically. I love Lily Nichols. She has a book that is called Real Food for Gestational Diabetes. I will link that in the show notes. She's just amazing when it comes to nutrition in general, but specifically she talks about gestational diabetes and using a very nutritional approach when it comes to gestational diabetes. So you can check her out, get some meal ideas, and just like I said, bringing more awareness, being more informed is going to help you feel more empowered and know that you still have options. This doesn't mean that you have to be induced. This doesn't mean that you have to have a cesarean. This doesn't mean that your baby is going to be massive. It's just bringing more awareness and understanding, hey, our body is going through this and we just have some more sugar in our blood than might be expected. And so really just understanding that, being kind to yourself and learning more about it is going to be super helpful. So no matter what your results are, you are not alone. There are so many people that are out there that are going through this. There are so many ways to support yourself through this season. And there is just so much more knowledge and information out there for you to really help navigate this stage. So thanks for listening. Hopefully this was helpful and you gained some knowledge. And if you are approaching your gestational diabetes test, or if you have just completed it and you're trying to figure out what all of these numbers and all of these results and all this information means, I hope it was very, very helpful for you. I'll see you later, and thank you for being here. Thank you, mamas, so much for listening. Remember, you are a rock star. I believe in you. Let's doula this. Let's crank it up a notch and let's kick it into high gear together. Hit that subscribe button, share this episode with a friend, message me, email me, call me, beat me. You know how to reach me. We're doing this, mamas. I am so excited to catch you here next week. This is your one-stop go-to place for helping you find the resources you need to make the best choices for you and your family during pregnancy, birth, and most importantly, postpartum. See you later, mamas.